The Ooni of Ife arrived at the venue of the Southwest Traditional Leaders Committee meeting in Abuja to review the outcomes of the committee's efforts in primary health care delivery since its inauguration a year ago. The Southwest Traditional Leaders Committee was commissioned in 2021 by the Ministry of Health to help the federal government mobilize grassroots support for vaccines uptake.
He's a man who His Imperial Majesty likes to address.
Beyond the advocacy, the Ministry of Health also wants traditional rulers to lead a campaign for investment in primary health care services.
For us to make progress in primary health care, we need the right complement of human resources. We need the right complement of infrastructure. We need your advocacy to the governors in those meetings that you have to improve the numbers of qualified health workers that are in the primary health care centers.
I also want to use the opportunity to humbly remind our royal fathers to continue with the sensitization of the public, again, as I said earlier, on education and on healthcare, and in healthcare on the benefits of immunization and then the primary healthcare system.
Reports by the Ministry of Health show an optimal performance in routine immunization among 3 southwestern states, namely Lagos, Ekiti, and Osun. The report also reveals a shortage in the number of skilled health workers in the region, a challenge the monarchs say they will help to address.
Being able to put ourselves together, and we traditional rulers, we don't want to leave everything to government to be doing. We have that fiduciary role and responsibility to take care of our people. It's important, and we're using the primary health care platform to reach out to them. And so far, so good. The MOUs is working, and we are not talking the talk, but we are walking the walk.
Traditional rulers are major partners with the government as grassroots mobilizers for vaccination against child killer diseases. And government is hoping that this approach will deliver improved health services to ordinary Nigerians.